this cadaver has a massive tear, which makes our job a little bit easier in setting up. And we're going to start by just closing down and putting a little margin convergent suture in. When I'm putting a BioBrace in, I want to use a triple loaded anchor. And we'll take the Y knot, triple and self-punching, self-tapping. You put it in, you get your angle. All right, I'm going to pull, set the anchor like that. And then what's nice is the sutures are all different colors. And then we're going to start sequentially putting these in. So I look at the color here. I like this bright blue one. We'll use that for our BioBrace. So I'm going to put those in first because I want the BioBrace on the corners. Go to the most anterior part of our tear. Again, sneak it around our little bicep remnant there. Get our next blue. Again, these are going to go through your BioBrace. So these are for our BioBrace. And we'll leave those aside. The other two, they're going to go through the cuff. I want to do in a simple fashion. So I'm going to start with my black, and then we'll grab the blue, and that will be a simple as well. Okay, now we're going to drop a second anchor in. All right, so this one's going to go behind our cannula. We're going to place it just a little bit posterior. We'll place our simples first. We'll grab the stripy one again. All right, and now we'll put our BioBrace ones in, which are going to be a mattress. So now we've placed all of our sutures we want to place. We're going to start tying. The key is suture management, so we're trying to get all the suture out of the way. So this is just a simple cuff repair of a massive cuff. Knot number one tied down. Okay, now we'll get that black one. Grab that one out. And then the other limb we know is still going through the tissue back here. Again, tie our knots down sequentially. I just do alternating half hitches. You just want to place your sutures from front to back and tie them from back to front. Again, we're just working from back to front. So you see our cuff has come over. It's starting to cover the tuberosity. This will be our last simple suture we're tying down. So now we have the cuff essentially repaired into place with a simple repair. And then we've placed our sutures for our BioBrace. So these are ready. So at this point, we have, our sutures for the BioBrace that we're going to use to anchor it. We've got one set in the anterior cannula, and then one set is in my percutaneous hole. So I'm going to go and I'm going to grab the anterior ones and bring them out one by one. So you've got your most anterior right here. Then I'll grab number two, because the key is you do not want to tangle these guys up in any way, shape, or form. So here's number two. And we'll tag him. Then I'm going to go in, get the third and the fourth one. Take my knot pusher, run it down to ensure we have smooth passage. And we do. So then I'll take my BioBrace, take a marking pen, and I make a strip on my medial superior surface. And then I'll put dots at my lateral superior surface. So you want to be about 5 millimeters from the corner, kind of near my dots there. I want to squeeze this, hold this firmly as you deploy the needle. So there's your luggage tag for one side. We'll pass the luggage tag on the other side. So now we have the two lateral corners that are secure of the BioBrace. Then our next thing, we're going to pass all these sutures in. So here's number one. Go number two, and then we'll tag those together. And we want number three. All right, so now our BioBrace is ready to go in. So you have your medial anterior sutures, your medial posterior sutures, and then your two lateral tags that we're going to use to incorporate in the repair. So you can use a grasper to just kind of push it through the cannula, and it's pretty durable. You have to get it through the diaphragm of the cannula. That's probably one of the harder parts. So now the BioBrace is in the joint. And then again, we want to secure these sutures down. So what I like to do is get so many out of the cannula. And I think it's easier at this point if I come in and grab these anterior sutures from this anterior medial corner. I'm going to pull those sutures out. And then I'm going to tie that one down first. And I think once you get one corner down, it makes the whole case easier. So now we have the medial side secure. And now we're going to use the Argo to secure our lateral row. All right, and then we want to punch for the Argo. And so we want to put this guy laterally. Walk it down. There we go. There's our hole. And you see that's brought our brace down. Cut all those sutures off. There we go. We already have that lateral row through, so we need to come and get these guys. We're going to put our next Argo up front. So there we have our patch deployed. It's down. That's all you got to do.